very good service. I've found it particularly beneficial, and I know that a lot of our patients use this service to great effect. I'm Dr John Glaholm, an oncologist working in a large general hospital in Birmingham, and I first heard about the healing service from chemotherapy nursing staff because I have allergy problems myself, and one of my colleagues suggested that Carol, one of our healers, might be able to help, and that's how it all started. And a number of treatments lasting 20 to 30 minutes after the end of my clinic, usually very stressful days, that I've found tremendously valuable. And I think the main thing is that it provided a feeling of tremendous relaxation and of just a feeling of well-being afterwards that has continued actually since then. But it's a very good service. I've found it particularly beneficial, and I know that a lot of our patients use this service to great effect. The service is certainly at present isn't funded by the National Health Service. It's purely a voluntary service that's provided by people who have a commitment to providing this kind of care. So we're all very grateful for that. But I think it's something that the NHS has to consider taking on board as part of a total package of care for patients with cancer, because I think the benefits are certainly significant. And I'm sure that the service as it presently stands couldn't offer treatment for everyone. It should be funded and supported, so that could be expanded to allow people, all the patients effectively, to be looked after, helped in this way. Before I went for the healing, I felt quite open-minded about whether or not it would benefit. I am quite open-minded about a lot of things. I have a saying that certainly even in conventional medicine, we often don't have answers to problems, full answers to problems, so you can't just dismiss something because you don't perhaps have a scientific understanding of how it might or might not work. I'd certainly recommend it to all the patients. I would like to see a completely comprehensive service available, certainly in this hospital, and I would see that it really should be something, as I said earlier, taken up by the health service in all aspects of oncology care. Given the pressures that staff are under, frontline staff in the health service, those that are actively caring for patients in clinics and wards, etc., I think the stress levels can be extremely high. Psychological burden of dealing with people who are ill is quite considerable, and this kind of service would be absolutely invaluable.
The Healing Trust has been supporting healing since the 1950s, so whether you're looking to receive healing or feel called to become a healer yourself, we're here for you. Subscribe to our channel and join us on this journey of energy, compassion, and transformation.